my name's Ernest Schmidt, and I'm the founder of Palo Alto Therapy. And today I wanted to go over one of the articles that I really enjoy. I've written a lot of articles for Palo Alto Therapy and for our clients. I like to share the different techniques and tools that we use for clients, and it's sort of fun to try to see if we can be helpful even through written articles, not to mention our one-on-one therapy. So one of my favorite articles that I wrote is called "To Be Safe or to Be Free." So I thought it would be neat to create a little bit of a presentation on that article. I think it has some really neat topics and really good lessons in terms of how best to kind of work with our anxiety. So let me try to share the screen and I'll do a little presentation and we'll see how this goes. Okay, so the article that I'm referring to looks like this, and I'm happy to pass this out to anybody that's interested. Just let us know if you want a copy of it. So the title is "To Be Safe or to Be Free," and this idea of reducing fear starts with the choice. So it's a little aggressive to say that. I don't mean to imply that we can all just choose not to be afraid, choose not to have anxiety, but it's an interesting concept when you think about, do I want to be safe or do I want to be free? Okay, before I get started, just a brief introduction. So again, my name is Ernest Schmidt. Started Palo Alto Therapy about 10 years ago. The real stars of the show are our team here. So really a great group of wonderful people who are committed to not only super high quality therapy, really learning and continuing to grow professionally themselves, so they can provide high level care for you, for those that want to access our services. And it's just amazing to see how much time we all spend studying this material to try to make sure that we are not only experts, but that we are good at what we do, that we also make sure that we're still warm and sensitive and understand that people come from different places and understand content differently. But it's just it's something I'm really proud of, to be the leader of this team, to really see such a good group of people come together. Not to mention our care coordinators also, who study the same thing: how best to answer the phone, how best to provide the best responses to our clients and be attentive and make sure that things run smoothly for us as a therapist, so we can provide the best care possible. And a big part of our practice is focused on cognitive behavioral therapy. That's sort of our main core type of therapy, which maybe at some other time I'll go into exactly what that is, but just wanted to mention that here briefly. And then, as most of you probably already know, we focus a lot on anxiety, OCD, panic, depression, stress, lots of different emotional mental health issues. But today we'll focus mostly on the anxiety piece. So the beginning of the article talks about the anxiety and the posture of fear. So it's an interesting concept, but a big part of anxiety, as you would understand, is it makes us want to avoid risks. So we want to stay away from things that are dangerous. And sometimes that posture of fear, that behavior of anxiety, actually increases the anxiety. So one thing you'll learn a lot about this emotion is it's very contradictory. It's a big paradox. The more that you try to run away from your anxiety, the more it follows you. I often use the analogy of a dog chasing a cat. If a cat runs, the dog will chase it. Sometimes at times when the cat is bold and they stop, the dog gets very confused and sniffs the cat, not quite sure what to do. So I like that analogy, only in the analogy where the dog doesn't actually eat the cat, but this idea that it sort of runs. Or when I use the example of me as a younger kid, when I ran from my brothers, I would get so much more frightened than if I just sort of held my ground to be protected and not to be hurt. So this idea that we have this posture of fear, and it makes a lot of sense when it comes to anxiety, that these fear behaviors, they often lead to us feeling more afraid. And this is really clear when it comes to almost all anxiety disorders or anxiety problems, but specifically OCD is a really good example. So those of you that may struggle with this, let's say you have a fear of the house burning down, and so you're checking the stove repeatedly, almost always that consistent checking actually leads to more fear. So in some ways you say, oh, by checking the stove constantly, you really are staying safe. You're seeing that the stove is not on, and that you'd feel relief, which you might, at some points you do feel a little relief in that. But generally it creates more anxiety. It's this vicious cycle. The more that you try to stay safe or protect yourself, the more actually it creates angst and insecurity and fear. The other piece you think about is the constant worrying that we may do. In some ways you think, gosh, I worry all day long. You think I'd be safe. I've got it all figured out by now. But we know that's not true. The more we worry, the more it leads us to feel anxiety and fear, not less. Unless we get to some sort of action item or some sort of aha moment, maybe we get some good relief. But generally, along the ways of trying to stay safe, we actually become more afraid. Lastly, same concept, but seeking safety often has us lead to feeling more vulnerable. The more that we're focused on staying safe, the more it reminds us of all the dangers around us and all the things that we're afraid of. So it's a really interesting paradox, as I mentioned before. Okay, so hypervigilance is another part that kind of comes with this. So you'd think, well, gosh, anxiety behavior in some ways makes me vigilant or hypervigilant, that if I'm hypervigilant, I should have less risk. And that may be true. That's the part about this that's hard to argue. And I don't ever want to argue that you shouldn't be safe. Of course you want to be safe. But when you think about anxiety help and our mental health, it's contradiction. The more that you try to stay safe, it doesn't necessarily correlate with your levels of anxiety. And in some cases, and my kind of main point with this article is that often when you're seeking the safety, you're actually more afraid. Even if we could argue that your anxiety behavior leads to less risk, you still may and most likely will feel more anxious. So that's a really important thing to keep in mind. Being on guard often reinforces that we are unsafe. And so we feel more scared. So it's this weird thing that we often then are left with this question, do I want to be safe or do I want to be free, from my anxiety? This leads us to this idea, this superstitious belief concept. So we start to believe, well, geez, our hypervigilance or our vigilance or our anxiety, that's the only reason we're safe, because we constantly are guarding. So, well, then if I drop that, I really would be unsafe, which isn't necessarily true. And also, we're then leading a life of a lot of anxiety and panic and fear, which is not, the most ideal way that most of us want to live. We don't feel comfortable. We don't have that peace of mind that most of us are seeking. The other part of this, which I think is important, is even if you can argue that hypervigilance is good and you want to stay safe and it protects you, which it may, we also find that when you're really high anxiety, often that can lead to paralysis or total avoidance. And so I love the picture of the ostrich, because it's just that symbol of you just stick your head in the sand. And my dad used to say that all the time. Don't stick your head in the sand, because then you really are actually at greater risk, right? You don't actually take any problem solving steps. You don't do anything that's protective. And it really does become a pretty irrational behavior when you look at it from a distance. So that's something to also keep in mind, that we could argue that your hypervigilance could keep you safer, but if it gets to a place where it's so overwhelming, it can be paralyzing and really then creates more risk. But I still love this idea that even if my anxiety gives me safety, would I still choose it? What would I choose more? My physical safety, my safety of my economics, or living with more peace of mind? And obviously you can go both ways. You can go too far one way, and I'm not saying live in denial, that would be awful. But there's sort of a balance that it's fun to think about this a little bit for all of our anxiety, not just clients, but me or therapists included. We have anxiety, and these are great concepts. So avoiding danger, limiting our lives. So this is the other kind of potential, downside to the hypervigilance, to the anxiety. Even if you can argue it helps you avoid danger, keeps you safer, you can probably see the side of that trying to stay safe can also decrease your freedom. So, this picture of the handcuffs, but it's so common that we see clients come in and their lives, and mine included, when I really struggled with anxiety, was so restricted. So it's like yes, you're safer, but you're just so restricted, right? You could stay in a nice little bubble, stay in your house, never do anything that's dangerous. And man, I don't know, that would be a pretty difficult life for a lot of us. Some of us might feel fine with that, and there's no judgment, but just personally, I didn't want that kind of restriction. And a lot of our clients come to us because they want more freedom. They're tired of that. They would say, fine, I'll take more danger, if I can just live more free. So I think that's important to think about that. It also undermines our confidence and our feelings of resilience. If we're not going out there and taking risks or seeing that we can actually cope with risks, we really don't have much confidence that we can do it. And we really believe then that we're not going to be able to cope with these dangerous things in our mind. And so this is a real big concept, but we all of us with anxiety, we tend to underestimate our ability to cope. And so we tend to cope way better than we think we would. And so that's another really, really important lesson and kind of a rule of anxiety that we try to get across in our teachings and in our individual therapy and in these articles and these videos, is this idea that you actually cope better than you think you will. And so when you see that you have these failures or these risks that actually come up in life when you're not totally avoiding them, you actually see, oh, I can do much better than I realized. And that lesson is so powerful. But you can't, I mean, you can try to think your way through that, but the truth is you learn so much more by experience. So by having those attempts and those, failures or those anxiety moments, and then you see that you did well, I mean, that's how you kind of break the spell of anxiety. Just another component about this, this idea that like, I will die from embarrassment. I just love that, it's something that we all kind of say, right, in our culture. And it just sort of shows you like the level of intensity that we have behind these sort of worries. And that, oh my God, I can't die from embarrassment. I mean, I know none of us really believe that, but the way that we say that, it really does increase our fear about embarrassment, that it's that dire. Me included, I don't enjoy being socially embarrassed, but obviously most of the time we don't die from it. We never die from it. And it's just embarrassing. Now we feel embarrassed. I always wonder, well, how much of it is it me feeling embarrassed versus someone thinking I should be embarrassed? I think that's often not the way, it's not actually accurate. Most of the time it's, I think I'm much more embarrassed than people around me look or judge me for, but that's another story. This big concept is our perception, not the outcome, is often what causes our pain, right? That we believe we're going to be highly embarrassed or that we're going to die from embarrassment. It's not usually the outcome, but if we're really afraid, we then avoid all that danger. We never really see the truth. So that's what also then perpetuates this vicious cycle. Choosing freedom over anxiety. So this is where it comes down to this sort of personal question, and it's a personal choice. Again, I don't want to put out there that you can totally choose to be over anxiety. I think that's kind of a misnomer that, oh, it's all about choice whether you have emotions or not. I don't really believe that, but it is when it comes to anxiety, there's a bit of a choice here. Like, are you willing to kind of bring down your anxiety, even if it means the level of risk might go up? But if your level of anxiety goes down, you're going to have freedom and more peace of mind. But yes, you might have the downside of more risk. I don't know if I totally believe that, but even if I did believe that, I think a lot of people would raise their hand and say, I'm willing to take a bit more risk to have more freedom and to have more joy and peace of mind and relaxation. So if you can honestly answer that question and say, yes, I think I would do that, even if that's not even necessarily true, that helps us get you in that direction then of, well, then here's some clear steps on how to get more of that freedom. What do you truly want? Do you truly want safety, or do you want sort of mental freedom? And that's a tricky one. I've had clients that have chosen both. Some clients will say to me, no, my physical health is so important to me that I'm going to continue to do all these things that clearly are disruptive to their lives, but potentially kept them safer. And that was their choice. The other part of this is those that say, no, I'm willing to take more risks because I want to get out of my head and be out of this sort of prison of anxiety. So if we go down to the path of I want to have more freedom, well, then this is where we kind of practice this throwing caution to the wind. And this is all within reason, obviously. I'm not talking about taking risks that really are super dangerous, but more just in the line of this sort of anxiety concept. Anxiety therapy, when you come to anxiety therapy, it's not like we actually can physically make your life safer, right? Unless you're putting your head in the sand. And then I think in those cases, for sure, we make you safer. If we can together work your way out of that avoidance behavior. But generally, anxiety therapy is about your mindset. It's not really about like physically doing things to keep yourself safer. If someone comes in with a lot of OCD around germs, we don't help them wash their hands better. We help them reduce kind of their guard. And honestly, we help people take more risks within reason, right? We call it exposure therapy for a reason. It's exposing yourself to more risks, more potential danger. This idea that we're restricted by our desire for safety. That's part of the problem with anxiety, is that we desire safety so bad that we get so restricted, but we want freedom from fear and we're willing to take more risks. Well, if that's the case, then we have to really practice embracing and seeking out risks and danger. And we want to do that in a safe way, relatively, but we need to be challenging sort of our fears. So yes, you're going to feel afraid doing these things. If you don't feel afraid, there's no point in doing the exercise. And that's how you really can turn the tide on anxiety and ultimately feel more at peace. It's a bizarre concept. It really is, to say to somebody that's feeling anxious, let's go do things to make you feel more anxious. But that's how it's done. And we do this, in a way that people get more comfortable with, and we explain the concept more. So I don't want to make it sound that simple, but I do want to get this across to people that this is a big part of it, throwing caution to the wind, which scares me even to say it, but that's part of it. Okay, so 3 more steps to freedom. Kind of what I already have mentioned throughout this article, but identify the areas where you currently attempt to control certainty and where you're hypervigilant. These areas where you're like, gosh, I know that I'm kind of doing too much here and it's keeping me more restricted. So identify those areas so we know which ones you want to work on. And then practice opening yourself up to those risks, which is, again, scary. And if you're not quite sure, obviously talk to somebody, and we're here to help if you need assistance. This is not easy stuff, and there's no shame in getting support and talking to people that do this for a living. But this is a part of it. It's really then practicing that. That's the exposure I talked about. And then observing the outcome. So really learning from those times where you've opened yourself up and seeing, wow, when I did those risky things, how was my anxiety? What did I learn? Did I cope better than I thought? Did things turn out the way I thought? And typically 9 times out of 10, if not more, you'll learn something really important from those lessons. And almost always that will lead to less anxiety. And ultimately, obviously, when you're doing these things at first, it's going to scare you. And if they don't scare you, then you're not really doing the right thing. So you have to have that anxiety, but this is a big part of letting go of that sort of protective avoidance and restriction, and opening yourself up more to freedom and to risks and to danger. All right. So that was it. I wanted to give this a shot. Hopefully you found that helpful. Obviously I'm from Palo Alto Therapy. We're here to help you. We do this kind of stuff all the time, but I wanted to at least try to do a video on one of my articles, and maybe in the future I'll do more of these. If you like this content, just let us know. That always helps us to feel more motivated to try to deliver more of this in this format. But I enjoyed giving it a shot today. So thank you, and hopefully it was helpful.